Adipose tissue's role as a rich reservoir of mesenchymal stem cells, commonly called adipose-derived stem cells, ADSCs, is perhaps the most striking example of how fat serves not merely as an energy store but as a regenerative organ with immense therapeutic potential. Unlike bone marrow, the traditional source of mesenchymal stem cells, adipose tissue yields a much higher number of these multipotent cells per gram, often orders of magnitude more, making fat an abundant and accessible source for regenerative medicine. ADSCs possess remarkable plasticity. Under the right conditions, they can differentiate into a diverse range of cell types, including osteoblasts, bone, chondrocyte, cartilage, myocytes, muscle, adipocytes, new fat, and even cells resembling neurons or vascular endothelial cells. This broad differentiation potential has made ADSCs an invaluable tool in tissue engineering and regenerative therapies. For instance, in orthopedic research, ADSCs are combined with biomaterial scaffolds to repair large bone defects or regenerate cartilage in osteoarthritis. In cardiovascular applications, ADSCs are being explored to restore blood flow to ischemic tissues by promoting new blood vessel formation, a process known as angiogenesis, through the release of proangiogenic factors. Beyond their differentiation capacity, ADSCs secrete a rich repertoire of trophic factors, cytokines, and extracellular vesicles that modulate the immune response, reduce inflammation, and stimulate native tissue repair mechanisms. This paracrine activity makes them especially attractive for treating conditions characterized by chronic inflammation or poor healing, such as non-healing wounds, radiation-induced tissue damage, and inflammatory bowel disease. Clinical trials using autologous ADSCs, cells harvested from a patient's own fat, have already demonstrated promising results in improving outcomes for complex soft tissue injuries, burns, and even some neurodegenerative diseases. Harvesting ADSCs is also minimally invasive compared to bone marrow aspiration. Small volumes of subcutaneous fat can be obtained through liposuction under local anesthesia, making the procedure both safer and more comfortable for patients. Once isolated from the stromal vascular fraction of adipose tissue, these cells can be expanded in vitro to generate sufficient numbers for therapeutic applications. Because they are derived from the patient's own tissue, ADSC-based therapies also carry a reduced risk of immune rejection compared to allogeneic stem cell sources. The regenerative promise of ADSCs further underscores adipose tissue's vital role in systemic health. It is not merely a passive depot of excess calories, but a dynamic organ providing a reservoir of stem cells capable of regenerating diverse tissues. This capacity could prove essential for future therapies aimed at mitigating the tissue loss and functional decline associated with aging, trauma, or degenerative diseases. As research continues to refine ADSC-based treatments, improving their safety, consistency, and efficacy, adipose tissue is poised to emerge as a cornerstone of personalized regenerative medicine. Altogether, the presence of abundant, multipotent ADSCs in fat powerfully demonstrates that adipocytes and their surrounding niche are anything but harmful or expendable. Instead, they provide a readily available, versatile, and patient-friendly source of stem cells, offering transformative potential to heal and restore the body, redefining adipose tissue as a regenerative organ indispensable for health and recovery.